Hello, today Silver Cross Video Magazine is featuring the Medical Records team, a group of people that work in different locations, including their homes, and so we don't often get to see them. So today is a chance to thank them and learn about all they do behind the scenes and help everyone really understand what a critical role medical records does play. With me today is Jan Drews, Director of Medical Records, and Julie Barone, Reimbursement and Coding Manager. So welcome to both of you. Don't be nervous. We're just having a conversation. All right, so Jan, let's start with you. You've been at Silver Cross many years now. How long has it been?
Yes, I've been here 18 years.
Wow.
So I've gotten to see a lot of changes from the old hospital to the new hospital.
And you've been in the middle of a lot of changes with the EMR and everything else. So thank you for those years of service.
Thank you.
And how about you, Julie?
16 years.
Oh my goodness. You two have really worked together a long time.
We have worked
together. We still like each other a lot.
We do.
That's great. It's good to know. So, Jan, how about we start with you? Why don't you give us an overview of what Medical Records does and the important role that your team plays?
Sure. Thank you, Ruth. So we have many different areas and locations for medical records. So starting here in the hospital, we have 3 teams that Erica Trejo, who is our manager of record processing, lead. The first team is our document imaging team, and they're the ladies that go to all the units, nursing units, and to all the outpatient areas in the hospital to pick up all the paper records. And they scan, and they quality check, and they index the records so that they're entered into the Cerner EMR, and that way the providers can see the records. Mm-hmm. It's a tough job.
It's a tough job. And during COVID, they were on the floors.
Yes, they were.
Yeah.
And then our second team is our physician analysis team, who work very closely every day with the doctors. They assist the physicians to make sure they're getting their records done in a timely manner, because we have Joint Commission regulations and we have CMS regulations. So they work with them through communication of fax and letters and phones, and they're actually even in the doctor's lounge helping them out.
I've seen them there.
Mm-hmm. And then our third team is on the first floor, and that's release of information. And they're helping our customers, our consumers that need a copy of the record. And they're able to get paper or a CD, a secure email. And we always make sure we point them to our portal too, My Silver Cross, so that patients can have access at any time to what they need for medical records.
Really important. It's always confusing if you're going to go see a new doctor, I've got to get my records. How do I do that? So it's good to know that there's many options. And how about you, Julie? What do you oversee in this team?
I oversee both inpatient and outpatient coding. This consists of both on-site and remote employees. We work closely with our coding coordinators who are on-site and our coding quality specialists to make sure that our coders are following the official coding guidelines, which are updated every year. We also make sure that our coders are receiving continuing education so that our coded data for the facility is accurate.
Let me ask you a question. How many codes are there?
Oh my goodness.
Yeah, I figured.
that one threw me. There's a lot, and we just have our October 1st update. So
I think it's over 200,000.
Oh,
there's a lot of codes.
So these folks have to be really well educated and get the right codes, and so
they do. We also it's about the codes, but it's also about we do work closely with CDI, and that joint effort between us and CDI, it really and truly is for the physicians to ensure that the documentation that they record is an accurate representation of the patient's visit.
Right.
That's helpful for the patient, but it's also helpful for the facility because we get accurate coding.
Yes. And the doctors. And so, Jan, you've often said to me that medical records is in the middle of revenue cycle. Now might be a good time to explain that.
Yes, we are right in the middle of revenue cycle. So everything that feeds to us from central scheduling, registration, all the physician and nurses documentation have to flow into us, because that's the documentation that we need for Julie's team to code to be able to translate that into an international coding system for billing and statistics. And then we take that information and we want to send it accurately on to patient accounts who are behind us in the revenue cycle. But we have many other team members that we work with.
God. So if somebody wanted to pursue a career in coding or medical records, Julie, what would they have to do?
For coding, there is formal education. It's between 2 and 4 years. That would give them the degree of either an associate's or a bachelor's degree through the university. They could do a community college as well, but they also have to receive continuing education because after they receive their formal education, they receive a credential. There's many different credentials. The basic that we have in our department really would be a CCS, Certified Coding Specialist, RHIT, Registered Health Information Technician, and RHIA, which is Registered Health Information Administrator. So that would be the initial avenue if someone wanted to pursue that.
But lots of options, really a great career path in this
Well, they
area.
do go through either 2 to 4 years of school. I don't think most people know that there's a medical record school. And we have to go through 2 to 4 years of college, and we are certified through the American Health Information Management Association. We have to sit for our boards, and we actually have continuing education credits that we must get annually to keep our credential for the field.
Right. A lot of responsibility.
It is.
Thank goodness we have such good leaders. So, Jan, a lot changed at the height of the pandemic. I keep saying, during the pandemic, we're still in the pandemic. So what has that meant? What did your department have to do differently?
We had a lot of unique situations with the COVID-19. First of all, the staff had to be very flexible with their schedule because, of course, our workload is based on the fluctuations of the patients coming in the hospital. We're very grateful that they were able to do that for us. Our document imaging staff, as you know, at the beginning of the pandemic, no one really knew what COVID-19 was, so it was very scary that they had to go to the floors to pick up records there. They didn't know what ramifications would be from that. Luckily, nothing, which was good. But we did have one employee, Michelle, who actually volunteered to be the one to go to the COVID unit. So the rest of the staff didn't have to rotate doing that. So we were very grateful on that.
That's great. And Michelle had all the proper PPE.
Yes.
Okay. Good.
And we had the coders had an additional stress because on an annual basis, the government puts out our coding changes, whether they're new codes, deleted codes, or modified codes, every October 1st. But during a COVID pandemic, March came and they gave us codes. We didn't even know what a COVID diagnosis was. Then they changed them and added more in April. They changed them and added more in September, and we have another change coming October 1st. So this year has been unheard of in our field, and the coders have really had some added stress. But again, they were very flexible as well with the scheduling. So.
Well, many thanks to Michelle and everybody on both of your teams for doing such a fabulous job for us. Any closing words that you want to say to the group?
I'd just like to thank the entire staff. I know that I work daily with the coding staff, but being so close to Jan, our offices are right next to each other. I'm also privy to a lot of things that happen in the department, and I think that we have a really wonderful, cohesive department. I think that we have really wonderful teamwork on all levels, and I just want to make sure that everyone knows how much we appreciate that.
And I appreciate it as well. You get the last word,
well,
Ms.
thank
Drews.
you. We do have remote employees that work from home. Both our coding team and our transcription team work from home. And we have our business center staff as well. We have our coding associates and our management team. So I echo Julie's thought. First and foremost, I want to thank the staff because, especially this year, they have been so good to work with. They're just a lovely group of people to work with. Secondly, I would like to thank IT because honestly, with the electronic medical record, we rely on them heavily for the creation and maintenance of that electronic medical record. And especially Ridjo Thomas, he has supported medical records since the day he came here, and he's been wonderful for us. And then, of course, our Administrative Director of Revenue Cycle, Miguel Vigo, because he does roll up his sleeves and pull anything we need to assist us. And he really has pulled all of our teams together.
And the results speak for themselves.
Yes.
Excellent. Well, thank you both. Thank you for enlightening everyone here at Silver Cross about the important role that you play.
Thank you, Ruth.